Hi, I'm Dr. Ed Jacobs, the originator of Impact Therapy. This is Dr. Tori Stone. And we're going to talk about one of the concepts of impact therapy, or two concepts. And it's for anybody doing counseling. I write about in my book, Impact Therapy is the title of the book. I write about the idea that you need a lot of courage and creativity to be a good counselor. And I think having the courage to do something more than just talk, listen, to do something, we stand on the chair, we might lay on the floor, we'll go to the whiteboard. And having the courage to do that, for those of you that didn't learn to do that, I encourage you to really consider that. A book that you could read that might help you is a book by a guy named Jay Haley called Uncommon Therapy, and it's about this great therapist. His name was Milton Erickson, and that book gave me a lot of the courage to do what I do and what I write about in impact therapy.
And I think one of the things that me, in terms of when I was first learning impact therapy, getting permission to be creative, to use sort of my natural creativity and to incorporate more of who I am into the counseling session. We're not saying you need to get the theoretical knowledge, so we're not saying to go rogue. We're saying learn, get the theoretical background, but then use your own creativity and be courageous enough to do some different kinds of things in counseling that can bring about fundamental changes for your clients.
And I thought creativity, you had to write poetry or sing or play a musical instrument or do something, but the creativity we use is more just being freed up to use the whiteboard, and I can't draw really, but I still can make, the clients like it when you make it creative or make it more visual. One of the lines that Pat Love told me about, she said, the brain likes novelty, and that's really true, and that's what advertisers use. They use a novel approach to try to get you to buy their product, and I don't think we learn enough, or we teach enough of that to students, about trying to be creative and be novel so that the client remembers it.
Absolutely, and I think of Apple's campaign, Think Different. We have clients that are in counseling because they have maladaptive thinking patterns. They're thinking in the same way and they get stuck in a rut. So us providing a construct that they can think differently about, whether that's me using a prop, writing something on a board, or using language or metaphor in a different way, it helps for me in my counseling more than just a talk-listen approach to have a dynamic, different perspective on a problem.
For more information, go to impacttherapy.com. Thank you.